Good morning, everyone. Welcome to the joint meeting of the Beacon Council's International Advisory Committee and Life Science and Healthcare Committee. I'm Josh Markus. I'm the chair of the International Advisory Committee. And with me is Richard Bookman, who is the chair of the Life Science and Healthcare Committee. I would like to now turn this over to Richard to talk about his committee's purpose and goals, and then he'll kick it back to me and I'll tell you the same about the International Advisory Committee. Richard?
Thanks, Josh, and good morning, everyone. Welcome to this joint meeting of Life Science and Healthcare with International. Seemed appropriate for us to get together in the middle or, I would say even late early stages of a global pandemic and try to learn from one another. The focus of our committee is shifted a little bit from the past, in which the life sciences were the sort of primary interest. And at my initiative, we sort of shifted focus and now really trying to focus on building Miami as the center for healthcare innovation, not to neglect life science innovation, but really trying to focus on innovations around how care is delivered. And even a further focus of our efforts is how that care can be effectively delivered for the underserved, very conscious of health disparities, the way in which our healthcare delivery system does not do a great job for communities of color, for example, yet it is exactly in that space where there are tremendous needs and opportunities for healthcare business innovation. So we're really trying to build the conversation around healthcare innovation in Miami-Dade County, and our committee really enjoys and appreciates this opportunity to collaborate, Josh, with your committee and get an international perspective with some great international innovators, as well as highlight some of our own here in Miami-Dade. Josh?
Thank you, Richard. I am actually honored to be on the same screen with you. And I'm really pleased to be able to coordinate this with Life Science and Healthcare. So let me tell you a little bit about the International Advisory Committee, and then we'll get started with what you really came to hear, and that is the people who are going to speak today. The International Advisory Committee really provides strategic guidance and support for the Beacon Council's efforts, which are to retain and expand foreign direct investment in Miami-Dade County. We promote Miami-Dade County as a global business destination for the Americas and beyond. And members assist also with hosting foreign delegations who come to Miami, and with planning and executing international business development missions. We've had many successful business development missions over the years. Our goals basically are to identify new developing FDI markets, that is foreign direct investment markets, to attract business to Miami-Dade. And we collaborate with the foreign trade offices, the consulates, the binational chambers, and other partners to promote Miami's advantages. I am the chair of this committee, and Gina Polo is the chair-elect of this committee. All right, let's get started. I'm excited to have this first speaker, actually, Sara Suarez. Let me give you a little rundown on her background, and then we'll go from there. Sara has a public health background in social and behavioral science, focusing on improving wellness outcomes and enhancing the quality of life for communities. She has 12 years of experience in public health, working with marginalized groups, government, and community-based organizations on advancing health promotion and disease prevention. Her past work includes reducing community transmission of HIV, addressing the local opioid epidemic, and recently focusing on human trafficking. She works for the Florida Department of Health in Miami-Dade County as the director's liaison, assisting to advance the mission of protecting and improving the health of Miami-Dade County's residents. Sara, the floor is yours.
Good morning, everybody. Let me get set up and share my screen so we can start this presentation. My goal for you today is you're going to hear from some wonderful presenters about healthcare innovation. I want to go ahead and give you the epidemiological perspective and what's going on in Miami-Dade County. So you kind of have that knowledge and where we are with the COVID response. I do work with Florida Department of Health. That is a state agency in Florida, and we are one of the lead agencies responding to COVID-19. So let's get into it, the COVID-19 outbreak and where we are as of today. As of today, you can see we have 50 million cases globally, 9.9 million cases in the US, almost a million. We're gonna probably hit 1 million cases in Florida. And in Miami-Dade County, we have 187,232 cases. And I checked the report this morning. As of this morning, we have 403 positives.
Sarah, I don't think we're seeing your screen.
You're not seeing my screen. Okay.
Let me add while you're looking at that screen that there is a Q&A button at the bottom of the screen for you who are attending. And if you have questions for Sara or any of the other participants, please put them in the Q&A box and we'll be able to address them. Sara is going to leave right after her presentation, but she has graciously agreed to take a few questions. So, get your questions in for her sort of immediately. So we'll be able to do that. Thanks. All right, we can see your screen now.
Let me switch. Okay, there we go. So I checked the report this morning and we have 403 new positives and percent positivity, and that's a key metric for us at 6.3%. Now keep in mind with the tropical storm, a lot of our large testing sites were closed. So that has not been, unfortunately, we have been seeing an increase in cases. I believe on Sunday we were at about 1,000 cases. So with the closures of the testing sites, we do foresee that later this week cases will increase. So when we talk about Florida Department of Health and what our role is, we are, like I said, mentioned one of the lead agencies, and our focus is epidemiological surveillance and contact tracing. And historically, we've done this for over 100 years. This is not the first epidemic that we've addressed. There's numerous infectious and respiratory outbreaks that Miami-Dade County has responded to. So we're going to talk a little bit about what is the data showing and what is contact tracing reporting. So let's look at the total COVID-19 tests per day. And I want to give thank you to Florida International University. They operate a website called the Miami-Dade COVID Project, and they are one of the ones that are leading the modeling and being able to predict of what we're seeing. So when we started the epidemic back in April, when we first started getting cases, we were seeing about 2,000 tests a day. Now in about November, we're seeing 12,000 tests a day. And you can see the increase. We're starting to see about 13.3 tests added daily. We have about 72 testing sites in Miami-Dade County. That's inclusive of state-run sites, which is operated by Florida Department of Emergency Management, Miami-Dade County, which operates numerous testing sites, hospitals, and then you also have private facilities. So when people talk about being able to get a test, there's numerous opportunities throughout Miami-Dade County to receive a test, as well as the lab turnaround time. We have seen, in the beginning, it was an issue where we were seeing lab results coming back between 5 to 7 days. We're now at the point where we can see test results coming in within 24 hours. So that's really critical in the response and being able to get to individuals and notifying them that they're positive. This is the epidemic this is the peak that we first saw back in July. And you can see, and this is the positive COVID-19 tests per day. you can just kind of start seeing this is when we originally thought the surge was happening. We had gone down, and then around July is when we started to peak. And then this is where we are right now. We'll talk a little bit more about this slope right here and what we're seeing as far as in comparison to the surge that we saw back in June and July. This is an excerpt. You can actually see this is the line that I was pointing out. This is the past 2 weeks. And this is what the slope is starting to look like. Each day, we're starting to see a linear change of 37.7 cases a day. Now, we are, as much as we are starting to see an increase, one of the good promising things that was informed with us is that we're not seeing the same rise or the same surge that we saw back in July. However, keep in mind that there is an increase still starting to occur. Could it be from pandemic fatigue? It could be from a lot of reopenings. There's been discussion about that. I do have a slide that kind of that touches on reopening and where we are and how that kind of impacted the epidemic. So again, this is another function of looking at it. This is the other key metric that I mentioned, the percent positive. This is the proportion. And you can see from the past 2 weeks, the rise of how it's looking, and it's changing, the percent is changing, 0.25% a day. Now the goal is to be below 5%. The 7-day average was, for the past 7 days, was 7.1%. So that's something we really need to keep in mind when we're talking about community prevention, mitigation, and continuing with wearing the face mask, the hand washing, social distancing, because that does influence this number, this percentage right here. This is the proportion of positive COVID-19 tests by day. Again, this is just taking the proportion of total the test. This triangle was when Miami-Dade County entered phase 1. So that is when the governor and the mayor at the time went ahead and moved us into phase 1. We were coming down off of a peak, and then we surged. These two triangles right here, phase 2 and phase 3. So you can kind of see some of the impacts from the reopenings and what we're seeing with that. Now, one of the other key metrics that we look at is the hospital census, including ICU and the ventilated. So back in the peak, you could see we were at the highest we ever had was 2,299, and that was individuals who were hospitalized, and that was in July. As of now, we have about 103 patients who are on ventilators, and 103 that are hospitalized, 64 that are on ventilators. Now, one of the biggest things that's been influencing this is that it's been about 9 months of the pandemic. So when we first started, we weren't aware so much as the treatment as well as how to handle the ventilation. So you can kind of see here is when we were starting to peak, and now doctors are starting to improve the treatment even better. So as much as we're having a surge in hospitalization, we're starting to plateau with ICU and ventilation, which is good because the care has improved, as well as also keep in mind when the pandemic first started, a lot of the individuals who were catching COVID were older individuals. And now what we're starting to see is a lot of younger individuals who are ending up with cases. Right now, the median age is, I believe I saw today, 39, but for the past month, the range has been anywhere from 33 to 38. So it's a lot more younger people that we are seeing experiencing COVID-19. The COVID-19 deaths for Miami-Dade County is always behind. So you can see September 21st, we always lag when it comes to COVID-19 death data. And that's just because we're just counting the death certificates and just confirming that it is an actual case of COVID-19. The peak was July 17th. Again, everything happened in July. And July 17th, we had 76 deaths on that day. The last I've seen, I believe, is that we're experiencing maybe 1 to 2 cases again. This is back from September, so everything's starting to catch up. We're about 8 weeks behind, but we're not seeing the deaths that we originally saw back in July. So let's get a little bit into contact tracing, because that is one of the mitigation strategies that is recommended, and that is something that we do in order to notify people so that they're able to isolate and quarantine. Now, isolate is for someone who is positive, And if they're symptomatic, the requirement is to stay home for 10 days. Quarantine is an individual who is identified as a close contact of a case, and the minimum that they are required to stay home is 14 days. Now, one of the things that we've heard a lot of is close contacts, that if they get a test, a COVID-19 test, while they're in quarantine and it comes out negative, that they're no longer required to quarantine. That is a myth, that is false. The incubation period for COVID-19 is 2 to 14 days. So as much as you may have tested negative on day 5, it doesn't mean that you won't develop COVID-19 on day 11 and day 12. So it's really important that if you are identified as a close contact, that you stay home and you stay away for 14 days. So this is some of the data that we are seeing out of contact tracing. And this comes from a sample of our cases. It's not representative of all COVID-19 cases in Miami-Dade County. One of the key questions that we ask is, where do you think you were your potential exposure source for COVID-19? The most commonly reported answer is household and workplace. 50% of the responses account for that. And that's what we're seeing nationally. A lot of individuals are getting it within the household, as well as the workplace. Followed by, we're also seeing shopping, and shopping could be anything. It's not very much defined as a mall or grocery store. Followed by social gatherings. We have seen an increase in social gatherings of individuals going to visit friends, having parties. We had Halloween, so we do expect an increase in cases within the next 2 weeks. And that's one of the key things to know, is that usually you don't see a rise, especially on a holiday. You don't see the outcome for another 2 weeks, is usually when you start to see the impact of a holiday or gathering or some type of large community event. So when we asked, based off, if someone acknowledged that they were exposed at a workplace, the next question we ask is, what industry or where do they work? The #1 response is the healthcare industry, followed by protective services, which is defined as your firefighters, your police officers, your correctional security guards, as well as sales. So your cashiers, your customer service industry. Now keep in mind, healthcare and protective services never stopped working during the pandemic. They were our frontline responders. So it's expected in a sense that we would see higher numbers, especially in the healthcare field, of individuals experiencing or catching COVID-19. Now, the final question that we do ask is, if you are aware, do you know the source, your relationship source to how you caught COVID-19? And in alignment with the household response, family member is the #1 response, followed by the no known relationship. Now, keep in mind, when we're asking people, you're asking people, what did you do the past 48 hours? Who are you with? It's not uncommon to say, I don't know. And a lot of people don't. As much as we ask them, where they have, it's okay to say, I don't know, because it's just showing as much that there is community spread, which is what Miami-Dade experienced back in July. So it is common to see the family member, which nationally we're also starting to see. CDC just released a published article that family member and household is the most common source for COVID-19 exposure. So one of the key things that we do want to, messages that we do want to convey is that contact tracing is a key strategy for us in order to educate and also mitigate COVID-19 cases in Miami. It's really important that we have individuals participate as well as share with us their close contacts. When we do contact tracing, we don't ask for bank account number, social security number. We don't tell, when we call close contacts, we don't tell the name of the case. Everything is confidential when we're performing contact tracing. So the other thing I want to touch on is the indicators summary report. This just kind of summarizes where we are with COVID-19. So you can see the number of positive tests obtained is increasing. The proportion of positive tests is increasing. And again, I've always mentioned that is your key metric that needs to be below 5%. The number of COVID-19 tests performed is increasing. I mentioned that was about 37 new tests a day that we're seeing. Again, we average about 12,000 tests a day. Hospitalizations are increasing. The number in ICU is stable, which is good. The number on ventilators is good. And the number of COVID-19 deaths that we're seeing is decreasing as well. So these are all three right here, really key for us. The concern is the number of positive COVID-19 tests. This one is concern for us and something that we need to continue watching. So one of the new things, or I shouldn't say new, is one of the discussions and in the future opportunities that's going to come to Florida is the potential for a vaccine. This is Florida Department of Health is working with Center for Disease Control and touching on how can we do some pandemic planning and distribute the vaccine in an equitable manner so that it reaches all communities that are in need for this potential solution to the epidemic. So this approach is being guided by CDC. The report is available on our website, and you are able to go through the document and outlines what exactly, who our target populations are, our plans for mass distribution, as well as how we're working with our vaccine providers to go ahead and make sure that there is that mass distribution. Again, everything is provisional and subject to change. As you guys are hearing things in the news, we're learning just as much as you are. As you all saw, that there was a study that came out, I believe, with Pfizer that said the vaccine is at 90% I believe that's the correct one, using protective, and correct me if I'm wrong on that. We are also waiting for the date. We are also looking at the studies. That is truly what is guiding this vaccine distribution plan. However, one of the good things about FDOH is that we've had experiences with this before with H1N1 pandemic, our seasonal influenza vaccine, and most recently we did have a hepatitis A. Miami-Dade County, and luckily did not have as much as an outbreak compared to the rest of the state. We did have a recent hepatitis A outbreak that required vaccination. So one of the things that we learned from that is streamlining the enrollment process. Everyone that's engaging in the vaccine distribution is going to be enrolled into one system so that we're able to track the supplies as well as what's going in and out. We're going to expand our point of dispensing sites for max prophylaxis. That's what we refer to the vaccine sites as pods, point of dispensing sites, as well as the increased inclusion of community providers to serve as vaccinators. So right now what we're working on is setting up agreements. We already do have agreements in place with hospitals, providers, so that they can get enrolled into the vaccine administration program and then get it set up. So when federal decides to release the vaccine, that there's already a pipeline so that the vaccine is able to get to our providers so that they're able to provide mass prophylaxis. Now, the next question that we usually get is who's going to get the vaccine? How many vaccines are we going to get? Ultimately, as you see, this is all dependent on the studies. It's dependent on what is approved, and then it's dependent on how much is produced. I know Pfizer is predicting 15 to 20 million vaccines by the end of this year. We don't know how that is going to be distributed. We don't know who the priority groups are. We don't know how much we're going to get, how much Miami-Dade County is going to receive. So it's a lot of unknowns, as you can see, and we're learning, like I said, as much as you are hearing things, we're learning as well and preparing for what we need to prepare for. So far, the current federal guidance of the initial priority groups will be healthcare personnel, your essential workers, so your police, firefighters, paramedics, individuals with medical conditions that place them at high risk for COVID-19 complications, and in older adults age 65 or older. Now I am going to share with you, this is the timeline for the mass vaccine distribution in in the state of Florida. Again, this could always change. This is just where we're at right now. So phase 1, we're going to have potentially limited doses. Again, remember, maybe 15 to 20 million predicted. That's going to be mass produced by the end of this year. Should we receive a certain amount, it's going to be allocated for closed dispensing for healthcare workers, your long-term care facilities, your residents living there, as well as your first responders. As the vaccine availability increases over time, and one of the questions we don't know is one of the questions we've asked and we don't know yet is, when will we jump to phase 2? We don't know that because we still don't know how much is going to be available at the time that it's produced. So when we have enough that is available, we'll jump into phase 2, which is a larger number of doses available. supply likely to meet demand. We'll continue to distribute to critical infrastructure, to first responders, healthcare workers. This is when we'll start opening mass vaccination clinics for target groups. So individuals in the community that are identified 65 and older, with comorbid conditions, as well as starting to set up state mass vaccination clinics. Miami-Dade County is the largest health department in the state of Florida. We have over 30 different sites located throughout Miami-Dade County. We have discussed where the sites will be located, and we are located in areas that are central to individuals who are in need, communities in need. So that's to keep in mind, as well as we're starting to partner with some of the larger hospitals to get ready as well, and coordinating with a lot of the medical providers to get them situated. From there, we'll start working with our current vaccine providers through the routine delivery and starting to expand out to commercial delivery, commercial pharmacies in phase 3. So that's when we're already have a sufficient supply and demand is starting to slow, is when we'll transition to phase 3. And you'll start to see the pods open. Again, pods are points of dispensing sites to the general public who don't fall under the target group category, as well as your routine delivery and your commercial delivery. With that being said, keeping that in mind with the vaccine, it's always critical and important to continue to wash your hands, avoid close contact. The face mask is probably one of the key strategies to preventing COVID-19, as well as covering your cough and cleaning and disinfecting frequently touched surface daily. If we continue to do this, which we have seen, we did see the decrease following this surge in July, we should also continue to have a decrease in cases going into the holidays. With that, I thank you for your time, and I will be able to take some questions.
Josh, you're on mute. Josh, you're muted.
Am I muted? Hi. Am I unmuted now?
Yes, you are.
Okay, good. Thank you so much. That's annoying. I unmuted myself and I got muted again for whatever reason. So we have a lot of questions, and let me get to a few of them. There's a lot of data that is involved in these kind of analyses and everything. And someone has asked, how are you managing the data and using it to take actions and mitigate the challenges we're facing?
So one of the key things that we're doing in Miami-Dade County, we do not determine policy. That is with our elected officials. So we meet with them every week from your large municipalities, and we provide them the data. They get to see the same charts that FIU produces. They receive the same charts, and we meet once a week and we discuss where the data is. We provide guidance, and it's really up to the elected officials who go ahead and execute a lot of the executive orders that you saw throughout Miami-Dade County to go ahead and implement. So that's how we're using our data, is really guiding the elected officials on their decision making.
Sara, if I could jump in with a question. So first of all, thank you so much for such a clear presentation, and I think you certainly exemplify data transparency in public service. So for that, thank you. We all face a tremendous challenge with the vaccine program, and I wonder if you might be willing and able to comment on two aspects. The first is, we're probably in a sort of an unprecedented period of vaccine hesitancy, a certain amount of skepticism. And so I'm wondering how Florida DOH and particularly the Miami-Dade County Department of Health is thinking about messaging and public awareness. So that's, sort of on the one hand. The other thing that's quite distinct about this vaccination campaign is that those of us, whether it's University of Miami Health System or the County Department of Health, we're going to have folks coming to us saying, oh, I see, here's this grocery list of 10 different vaccines that have now been FDA approved. which ones for me, and that confusion, again, suppressing vaccination. So vaccine hesitancy and education campaigns, and how are you thinking about dealing with the multiplicity of vaccines becoming available?
So for the first question, built into the document that's provided to CDC from Florida's plan is a communications plan. So we are going to touch on social media, working with the radio, Facebook messaging, because you're absolutely right. With H1N1, there was a big push for that and it was not receptive. The public did not receive it well. So there is concern that we're going to set up these large pods with personnel, human resources, and have the same reaction we had with H1N1 back in 2009. So that's one of the things we're learning. And we're going to do a test run on December 1st with influenza vaccines to kind of see where we are with that. Now, influenza vaccine is very different from COVID, but at least to see the process, the flow, and how it goes with the distribution. So, and then as far as your second question, I won't be able to touch on that because I'm in the same boat as you. We're all learning. Yeah, we're going to have to wait and see what comes down from federal. One of the challenges I do foresee with this vaccine is that it's 2 doses. So individuals are going to have to come back in 28 days for the second dose. My concern is losing those people for the second dose. So I think that's going to be another challenge as well. And then now we're going to have more on the market. So
and just to be clear, that booster after 18 days, that's a characteristic of the Pfizer vaccine. Mm-hmm. Right? Not all of the vaccine candidates require 2. And of those that do require 2, they don't all have the same interval. So just to confuse things more, but yeah, it will be
interesting.
An interesting challenge. Yeah. Other questions for Sara?
Yeah, from the questions and answers. There's a couple that are kind of related. One is, what percentage of the tests come back within 24 hours after the patient was sampled? And the other question was, can collection and lab be done on site when testing is done? Is that in the near future? Sara?
So we see 90% of samples, specimen collections were returned within 24 hours. We've become so progressive with the labs, the testing. I don't foresee that as an issue in Miami-Dade County. So that is good. What you're referring to may be the antigen testing, which is done in 15 minutes. So what we see is that's done on site, and then individuals are able to drive off, walk away, and they receive a text message in 15 minutes when their specimen is done. I don't foresee that with the PCR, which is the swab. That is your gold standard test, just because of the processing and the specimen collection and the lab requirements for that. I see it with the antigens since it's already being done. And you see that that's done at Marlins, Hard Rock, and Miami Beach Convention Center.
All right. The part of this is to try to trace after testing. And is there a level of community spread that makes it impossible for tracing to occur, or are you running? You probably run into this already.
Yeah, we've heard this a lot from, especially when we had the peak and the number of contact tracers. So back in the peak, it was Miami-Dade County needed, and it was estimated that we needed 800 contact tracers for the population in Miami-Dade County. We got up to about 650. One of the things to keep in mind is that contact tracing is voluntary, but you also need the other party to participate. And we had a lot of issues, and we still continue to have issues of people refusing to participate, not wanting to share close contacts, and that's a disservice, especially when you have somebody who could potentially be COVID positive and is not informed of that. So it's a two-way street as much as we are doing the contact tracing, and 100% of cases are reached out to. However, if a case refuses to engage in it, that's where the case ends. And we've had instances of individuals refusing. Yesterday, I looked at it. We had for the last week, we had an average of 20% of cases. We tried to reach 3 times. And then from there, we had 12% of cases who just refused to participate. And that influences this epidemic.
Huh. is there a consensus on the period of immunity against COVID after someone catches it the first time?
No, there is no herd immunity. There's no consensus on that. Where this may have originated from is that if you are COVID positive, CDC recommends that you do not test for 90 days. Reason being is that most likely you will get another positive because it'll pick up the virus in your body again. However, there is no consensus on herd immunity or individuals catching that. And we do have cases of reinfection. So I do want to be clear, and we're starting to learn a little bit more about that as we do see cases come in. Hasn't happened in Miami-Dade County, but we have seen across other countries and across other states this taking place.
That's great. Well, Sara, thank you very much. We're at the time that we said we would be at, and feel free to stay on the call as long as you would like. Really, really happy that you were able to be on, and I've learned a lot this morning from you. Thank you.
And if I
Now
would just
I'd
want
like
to
to
add I just want to add my thanks as well, Sara, on behalf of the Life Science and Healthcare Committee, and underscore to those listening in how the critical role of county health departments, obviously in Miami-Dade, but across the country. You know, you are the sort of army of public health in the way we've constructed public health infrastructure in the US. You know, CDC is sort of the Pentagon equivalent, but you know, our county health departments are such an important asset in all the time, but certainly at a time of pandemic. So many thanks to you and your colleagues, and I think on behalf of all of us, please express our gratitude for the great work you guys are doing.
Thank you.
Tremendous. Well, let me just say now that we're going to hold questions and answers until the very end. But if you have questions or you know, when a presentation is happening, feel free to put it in the Q&A. I don't know if you were having trouble putting it in the Q&A as opposed to the chat. It makes it easier if it's just in the Q&A. So since I learned a lot from Sara, I'm sure I'm going to learn a lot also about what's happening in Chile from Anil Sarangani, who's the Director of Innovation from the Universidad de los Andes in Chile. He's been the Director of Innovation at the university, in charge of leading the institutional design and strategy of technology transfer and science-based innovation at the university for the last 2 years. And he's also a member of the board of directors of spin-offs and university initiatives. And in 2010, while studying for his MBA in the US, he developed a biotechnology venture, which is currently in a clinical phase. So without anything more, let me introduce Anil. Anil, please let us know what the status of testing and tracing is in Chile.
Thank you, Joshua. I would like to thank first the organizers for inviting me. A little bit of a notice, I'm replacing Dr. Maria Teresa Valenzuela. She's part of our national committee to deal with COVID, so I'll try to do my best. I'm going to share my screen now. Please let me know if you guys are seeing the presentation. Good? Excellent. Well, good morning, everyone. Like Joshua said, I'm a Director of Innovation here at the Universidad de los Andes. During the next couple of minutes, I would like to share with you what has been the Chilean response against COVID, the progression, latest updates, and of course, the mitigation strategies. And then my second part of the presentation is going to be more focused towards the innovation cases that we've developed from Chile to fight this pandemic. Well, it's a few episodes, I'm sure, in human history have shaped our societies and our culture, like the pandemic cases. And it's amazing that although this generates a big impact, we tend to basically forget what has been these health issues, right? In terms of Chile and what is the current situation right now, this is a chart that was updated yesterday, and it shows basically the tendency we've had during the last couple of months, when we had our peak basically during June, where we had around 7,000 cases per day. And now we are basically on a plateau of around, I want to say 1,900 cases during the last couple of weeks. Our total cases so far is around 500,000, and active cases around almost 10,000 cases. The cases per inhabitants are quite high. We're ranked number 8 in the world. And that's basically, as you will see in the next couple of slides, is that Chile is being concerned about doing a lot of testing. Our mortality rate is around 73, and our case fatality rate is 2.78. The amount of PCR tests we've done so far, I think it's a big number. We're very proud of that. And I'll show you what initiative we had to do as a country in order to be able to improve the standard that even Job Hopkins recommends for every country to do tests in each specific country. I want to say that the fundamentals of our country response were based on 3 main pillars. The first one being structural politics. There was from the beginning, political alignment that nobody had to suffer a decision like maybe they had in Italy, where they had to decide which ventilator was going to patient A or patient B. I think we had enough political, alignment. Risk communication was well done, and of course, social participation. Our second pillar was trusting science, and that was, I think, one of our main lessons learned. You have to trust the data, trust science. We developed a national network for diagnosis to deal with every case, and now we've implemented over a month ago a national strategy to get our vaccine also to all the Chileans. And I'll show you a little bit more about the public and private strategies that we've been dealing with. And also our third pillar is basically the community and individual engagement. We've had dynamic lockdowns, of course, social distancing and behavioral changes, isolation and traceability. And we've tried to communicate this with the population of Chile, which is, as you may know, very different. We have a very sector that is very wealthy and they know more, but we also had to educate the rest of the population. And that's where I think the government was dealing with, trying to communicate all the different strategies. The main scope of action was, again, in the mitigation and containment. I want to say that some examples, for example, that we had measures that seek to reduce, prevent the dissemination and infectiousness, of course, and the spread of the virus. So again, basically what every country was doing: social distance, quarantine, and use of protective equipments. We followed the TTI strategy, which is basically testing, tracing, and isolation for all clinical care cases. And of course, education. I think that was, again, a lot of the effort have been put into educating schools, educating people in the university, having specific ambassadors in each county so they could be representative in each specific geographical state. And that's the way I think we've gotten to all the population in Chile, which I do need to remember that has high levels of literacy. On the sanitary level, we've been engaged more on preventing the health system to collapse. So from day one, we centralized the coordination of the public and the private resources. So basically, for example, all the ventilators from the surgery rooms were centralized, and then the Ministry of Health was able to determine where those ventilators could be allocated in specific regions in Chile from north to south. And of course, thanks, I think, to this strategy, we never had a person that couldn't afford to have a ventilator in his bed in case he needed. We also strengthened our health system. We went from 900 beds to almost 3,200 beds in order to take care of the crisis. And we also generated an ambulatory hospital, which is shown here on one of the first pictures. We basically reconditioned a space that was usually used for entertainment, and we transformed it into a big hospitals where we had almost 1,000 beds, and that was the way we could deal with the COVID cases. Of course, we kept the strategy for detection, monitoring, and tracking the cases. Then we had 2 more scope of actions, of course, economic. I know this is also a business meeting, so we had some measures to support households and families. And of course, measures to support some of the SMEs and some of the companies that had to suffer during this last couple of months due to the closure of most of the businesses here in Chile. And the last pillar is basically the psychological support, and how do we engage also as the government to basically be more human and dialogue orientated. You may know that we also had a social crisis in October last year. So we basically had in October the social crisis, we started to recover. We had in March the first case of the pandemic. So everything was unluckily connected, and the government and all the public and private actors had to basically pull up the sleeves and try to help. This is a paper that I really recommend that summarizes in a better way the data that I have given so far. And I basically extracted this figure that shows a little bit of the history that we went to here in Chile. Just to make sure some points I want to basically highlight is basically that in January 20, there was a national alert that there was a specific COVID action plan design from the government. Then we also generated our advisory board in which Maria Teresa Valenzuela participates and has been working since January. In February 8th, our official gazette published the alert for a public health emergency. So that was already done in February. And we had our first case in March 3rd. This is when our summer holidays finished. So we had all the people that had traveled to Europe, basically, and Asia, come back to Chile. And that's where we got our first cases that was, of course, reported. Then we have almost 2 weeks after, we closed all our schools, and they're just starting to reopen as of last week. So we had our schools closed. We had our national curfew. Also, the borders were closed nationwide, so you couldn't travel into Chile, outside of Chile, unless you had a good explanation or justification. We continued with the small area lockdown stages, and then we started to relax our interventions. But again, we saw that the curve was not acting in a properly manner. So we had 90% of the population in the capital of Chile, where we had basically 60% of the population of Chile in lockdown again. And this is what I want to say the biggest or the most weird cases and most strange cases where we had to do lockdowns and large-scale lockdowns. We couldn't even travel from one region to a different region. Everything was closed. We had a sanitary cordon, so we couldn't move. And that was excellent to basically keep the focus and the virus only in a specific region that had high cases. We also developed a step-by-step strategy where some of the regions right now in Chile are basically on preparation mode. At least 80% are still in transition mode, and we hope to basically move on to step 4 and step 5 in the next couple of months if the virus allows us. In terms of developing a couple of initiatives, I want to focus on this one, which is how do we develop our national diagnostic network for laboratories? And this is basically was led by our Public Health Institute, which started training some labs that have the equipment and the people that were able to run the tests. So we went from 6 labs that we had in February to 50 to 100, and today we have almost 150 labs running nationwide, people that have been trained and have been accredited to run the test. As you can see, this is a map of Chile, and we have labs in every region of Chile from north to south. And the important here is that we had a very good communications, like I said, with the government, with the universities, both public and private. And the universities basically donated the qPCR equipment in order for us to do some of the testing. And like I was saying in the beginning, Johns Hopkins recommends basically 150 tests every 100,000 persons, which is basically 25,000 tests for Chile. Right now, we are performing almost 35,000. So we are above that specific limit. And again, we also developed our national online platform, which is able to report all the cases that become positive, right? At the same time, in June, there was a decree from the Ministry of Science in where a specific advisory board was developed just for the COVID vaccine in order to start a phase 3 of some of the vaccines that are developed abroad. Basically, we have some contact with the Chinese vaccine from Sinovac, also the vaccine from J&J, and I think there's some negotiation going on with the Pfizer vaccine in order to perform some of the phase 3. Again, there was a new experience for us. It was the first time that we had interinstitutional teams of experts with institutional supports. So all the private universities and public came together, all the faculty of medicines came together and coordinated the clinical studies We have an MOU already signed by all the different presidents of the universities in order to run this, because most of the universities in Chile have the teaching hospital, and that's where we're running our clinical trials. For my second part, I would like to focus on some cases that have arisen from Chile. The first one I want to talk about is our initiative called A Breather for Chile. And this is basically to be able to manufacture with Chilean technology these ventilators. So we had a big grant from the Ministry of Science in where they received 35 prototypes. They had 4 that qualified for the finals, and 4 of them right now are performing clinical trials. Again, this was a big collaboration even between our naval R&D department, which is ASMAR. They're dedicated to building shipyards, but they transfer this, basically all the know-how in order to help to build these ventilators. We have the Universidad de Concepción, which is in the south, leading this initiative, and again, different universities doing the in vitro and in vivo validation. And right now we're doing our clinical validation. A second product that has come out of Chile has been this one developed by Cura Biotech. It's called the AbioResist, which is from a sample from saliva. You're able to detect in 3 hours if you are positive for COVID or no, and it has been tested already in 80,000 persons here in Chile. It's very widely used for right now for different companies that are returning back to work. This is another test. It's based on an olfactory basically analysis. And again, it's simple and non-invasive. They basically have a smell profile where they've been able to detect what are the different smells that the person that could be infected is able to determine. This is run then by an algorithm, and of course, then you get your data analytics and report it in order to diagnose the patients. And again, it's less than 3 minutes, easy to apply, and you don't need any specific equipment. So this is part of the core initiative that has been developed by the Universidad Católica, also here in Chile. This is an initiative that we've been leading at Universidad de los Andes, our Department of Innovation. And it's basically, how do we generate an EPP, basically a protection equipment that is able to inactivate the virus. It's been widely known that copper is a very good antibacterial molecule, but we also had some data that demonstrated that it was a very good antiviral product, specifically for HIV. So we had the hypothesis, why don't we try our specific copper nanoparticles to see if we could inactivate also our SARS-CoV-2 virus. So we did a collaboration with this company, Copper 3D, and we took the copper from our mining industry here in Chile, which is huge. We generated the nanoparticles, and of course, through different iterations, we developed our nanomask, which is basically this mask, which is generated with nanoparticles of copper. It's 3D printed. We're able to publish the design freely for everyone to download it in every country in the world. It reached, I think, almost 80 million downloads around the world. So it's been very successful. And we just got data last Friday we did a collaboration with the Institut Pasteur in France, and we demonstrated that these nanoparticles that are used for 3D printing are able to reduce or inactivate the virus. This is the virus sample that was used, the isotype, and we see that after almost an hour, we get 99.9% reduction. And of course, it's maintained during time. Of course, this has gotten a lot of national and international press, and we're very proud to be collaborating with this company in order to take these innovative products to the market. And lastly, I would like to talk about some treatments that have been developed in a university in the south of Chile, which is the Universidad Austral. Basically, they're developing antibodies from ALPACA. One would wonder, why is ALPACA important? Because they develop naturally these nanobodies, which is basically smaller antibodies, which are more stable. They are easy to produce, easy to modify, and of course, they have very high affinity. So they have developed already this antibody against the virus. And what they're doing right now is basically working on a nebulizer that could reduce your viral load once you get infected in order to reduce the signs of the virus. This is the picture of the alpaca that was able to generate the antibodies. It's called Buddha, and that's the one that they're using in this university in order to explore its potentiality for treatment and, of course, to diagnose the virus in the next couple of months. And as a little bit of the lessons learned from us, always trust your data, trust science. we've been able to see that we are able to avoid bureaucracy. It's possible for the government to release a grant in 2 months, provide the money in a month, and have results in 2 or 3 months. We don't need, again, these longer time periods. If you want to do it, it's possible. The health ecosystem is willing to collaborate, both private and public sectors that I've shown. We also had a very good mechanism to insert foreign doctors into the health system in Chile. We had a lot of migration from different countries, and of course they had to run their own tests and they had to be qualified, but we had to basically speed up their insertion into the health ecosystem, and that was done in a very professional way. And of course, some of the lessons that we also have to take care of our elder population, and we have to start digitalizing our medical teams, because this will generate more data, and more informed data, of course, generates better decisions for humanity. And with that, I'll leave it for questions during the Q&A session. Thank you very much. I'd like to also thank ACELA for the invitation, and for Chile as part of the institutions that invited me to this talk. Thank you very much.
Joshua, you need to unmute.
And now I unmuted myself. I'll get it at some point. Dr. Sara and Gani, thank you very much. I appreciate that's a tongue twister for me, but you obviously didn't have any twisting of your tongue in telling us in English what's been happening in Chile, and it's very, very impressive. I wish we could do that here for sure. And so now I'd like to give the mic over to the Consul General of the country of Germany, Andreas Siegel. He has a very, very distinguished background. He's a career diplomat. He holds postgraduate degrees from the College of Europe and the University of Freiburg in Germany. He's has a long connection with the US. He was an AFS exchange student in Michigan. He served as the vice consul at the Consulate General in Boston. He comes to us from Vietnam, where he was the head of the German Consulate General in Ho Chi Minh City. There's so much to give you of his background. There's a lot, but I think I will cede the time now to Andreas to actually give us what you guys came for, and that is information about the EU, not only contact tracing, but also the situation in the European Union. So, Consul General, the floor is yours.
Well, thank you very much. Very kind for having me in this very interesting conversation. The previous speakers have already outlined the important points of medical and scientific situation, which obviously is discussed in Europe as well. But as you know, Europe is a complex structure with 28, rather 27 countries united in the European Union, with the UK now sort of Brexiting at the moment. But as we all know, the pandemic is a cross-border phenomenon, and in Europe, we usually have a freedom of movement of people. So that poses a lot of challenges and is also sort of a reason why it is so important to cooperate, not only within different regions of one country, but between among all the countries in the European Union. And so I'm going to address some of the points that are being discussed there, which are not only concerning the health sector, but also other challenges as well. If we go to the next slide, we can see that the situation is dramatic. 250,000 people have died. In Germany, the number of death casualty is quite low, as you can see, 11,500. We can come back to that later and I can try to explain why that is the case. But we have currently this big new wave with 50 million cases worldwide. and of course with a huge economic impact, which cannot yet be sort of appreciated or judged in detail. But in the EU, the GDP is expected to shrink by 6 to 8%. And if we go to the next slide, we will see that the challenges are not just concerning public health, but they are political, economic, and communication challenges as well. As has been pointed out, of course, prevention, mitigation is key, but targeted testing and reliable testing and notification and tracing is as well important to avoid sort of hospitalization overload and the so-called triage, this sort of very bad choice that doctors may have in a situation when they have to decide, do they want to treat sort of an elderly person or with pre-existing conditions, or do they want to treat a young person who still has sort of a long life perspective ahead. So that these are situations that, of course, we need to avoid. The vaccine is, of course, a new hope, which is now coming nearer. By the way, the project which is being discussed since yesterday with Pfizer, it's a cooperation with a German company, BioNTech, and of course, the issue is as well to verify the quality and effectiveness of that vaccine, and to have access for as many people as possible for this vaccine. Having said that, the economic situation is still very dire, and it's not clear how it's going to be developing in the next few months in winter times in Europe, with probably many cases of unemployed as well. If we can go to the next slide. That's why early on in the summer, the EU heads of state and government have decided a huge recovery package, which is sort of amounting to 700 billion, that is like $800 billion US dollars, which is targeted to help small and medium-sized companies in particular, and help national governments and regional governments to boost some recovery measures at their level. And it's also a long-term injection of money into the sort of the perspective of the next 7 years, the long-term budget of the EU, to address some of the sustainability issues that are at stake. We can go to the next one. Well, this is just to show the trend which we have seen since August, September. The cases after the summer travels have drastically gone up and are still going up. We can see that, however, one positive aspect in Europe is that the death rate in comparison to the first wave does not follow as quickly as sort of in the first wave. So we hope that this will remain the case, but still it is a very concerning situation. Can we go on to the next one? So that's why, first of all, testing is very important. Just to throw in a figure, in Germany we had 1.6 million tests, which is about 2% of the population. If we did the same thing here in the US, we would have 6.5 million tests during a week. Now, in Germany and in Europe, there is a consensus that testing is key to try to control the problem, and not only to have sort of the overall prevalence, to have an idea of the overall prevalence of the pandemic, but also to target the tests to key groups and communities, like the high-risk population, vulnerable people, close contacts, workplace, as has been pointed out, is one of the key infection places, health workers, schools, and of course, traveling entry from people who are returning from high-risk countries. We go to the next one. So that again points also to the link between testing and tracing. So tracing is apparently difficult, and that has been discussed back and forth. If your infection rate is exceeding like 70 or so per 100,000 people, because afterwards you cannot identify anymore where the clusters are and where the origins of the pandemic or of the current spread are from. Of course, you need also very quick results and reliable results of the tests. They need to be available within maximum 24 hours, which I made the personal experience when traveling to Frankfurt in August. I was tested at the airport, and I had the results 6 hours later. So that was sort of a good timing. Another indicator which is discussed certainly in Germany is the so-called reproduction rate. That is a number which indicates the quota of people you are likely to infect. And for example, if the rate is 1, you have a risk of infecting at least one other person. If it is under 1, that is a good indicator that you are on a downward trend and that the infection rate altogether the curve will bend downwards. Whereas if it's way beyond 1, and that is the case in many countries now in Europe, that means that you have not only a linear, but possibly a exponential curve upwards. You see the next slide? So that's why the governments in Europe and the European Commission, as the sort of executive organ of the EU institutions, are propagating a number of measures and recommending a number of measures, but which are, I think, mainstream now in the discussions as well in the US and elsewhere, as we just heard also from Chile, that of course you need a good communication of the decision making. You need a good coordination between regional and national levels and European level in that case. One interesting thing I will come to shortly is you can use apps to detect and trace the infection, and that can be used also sort of as an identification tool, which in many countries is not yet available. But of course, the essential supplies have to be secured. The hospital saturation rate has to be surveyed. Travel has to be controlled to a certain extent, which is the case with a number of travel restrictions, as you know, mutually between Europe and the United States. And if all that works, you can establish some kind of green lanes where you have, for example, for people who have an application and who have proven to be sort of negatively tested twice or so in a certain interval, that is key to fluidify also the cross-border transit. We go to the next one. Still, it is, I think it's common sense to increase and try to obtain more even effectiveness of testing, and to promote also a EU-wide recognition of the testing methodology and of evaluation and of strategies. We go to the next one. In order to do that, of course, you need to communicate and to reach a consensus on what is important in this, in the whole sort of pandemic control situation. And I think it is a consensus that that certain vulnerable groups have to be targeted, that you need enough resources, that you need an easy access to vaccines, and that all this has to be regularly and clearly communicated. We go to the next one. Now, in many European countries, there is a new, well, lockdown is the wrong word because it's not a real lockdown, but it's a stricter control of movement, and a number of measures are in place to prevent the virus from spreading. That is face mask mandatory in public. Cafes, restaurants, and bars are closed, but can have curbside delivery. Accommodation also only for non-touristic purposes. Private gatherings only permitted for 10 persons maximum. Leisure activities in institutions should close for the time being. Beauty salons, gyms as well. Whereas schools, daycare facilities, and so on, and shops and hair salons remain open. That's the situation for Germany, which has been decided and which will be valid until the end of November for the time being. Next slide, please. So I was talking about the tracing and warning apps, which were first developed, I think, in Germany, and have now been, the different apps have been developed in different countries. And as recently as, I think, 3 weeks ago, there has been an agreement and a technological compatibility study that now these different apps communicate with each other, and you have 21 European countries which can actually use these apps to track the coronavirus. Next slide. The fact is, however, that there is still, and in Europe, I think even more than here, there is a fear, or there's a great concern about data protection, and that many people still hesitate to share the data with others, although all the experts say that it's really a safe methodology that is being used. But if everyone, or if a maximum share of the population used these apps, a cluster identification and mitigation would be possible even more than it is right now. Next one. So this is just sort of a short summary of the parameters that are being discussed in Europe and the issues that are concerning the European countries. But it is a worldwide challenge, so I think it's essential to have also worldwide communication on this, as we are doing right now, and to cooperate on this worldwide. So that's why we think we can do many things together and achieve things together, Germany and Europe with the United States. Thanks.
Terrific. Thank you so much, Consul General, for that. We're going to have questions and answers at the end. So if you'll bear with us, we will do that. And in the meantime, let's move to the next, which is a business showcase. And I'm going to take an executive privilege and have Michal Cooper present first. She works as a strategic partnership director at New Site Imaging, and she leads all the technological collaborations alongside the marketing department at New Site Imaging. Prior to New Site, she managed projects in the Ministry of Tourism and led international delegations to Israel with the Ministry of Foreign Affairs and the Israel-Asia Chamber of Commerce. She was on the board of directors at the Hebrew University Student Union, representing the social sciences faculty. She has a BA in International Relations and Asian Studies from Hebrew University. And without more, let me introduce then Michal.
Hello, thank you very much for inviting me and for this introduction. I will try to show you in the short time we have about our activity during COVID. It's pretty exciting. I'm going to share the screen of my presentation now. Can you see it?
Yes.
Perfect. So as I was introduced, I'm the Strategic Partnership Director at New Site Imaging. And also I have an acting director position at VirusSci Diagnostics, which is our subsidiary company with Sheba Medical Center. Basically, Sheba is the largest hospital in the Middle East, and it is also recognized by Newsweek 10 in the world, of the top 10 in the world. And basically what we have done is we have taken our technology for diagnosis, and we created a JV with Sheba to offer a solution for COVID and other pathogens diagnosis to the market. So this is what I'm going to present to you now. And this new company, which was launched just recently in Israel, also in the presence of the Deputy Minister of Health and many other leading in the medical sphere in Israel, is called VirusSci Diagnostic. And I'm going to present you shortly our solution and what exactly we're doing. So VirusSci is basically an AI software company, which is based on New Site's spectroscopy solution, meaning we as New Site, we build a small spectrometer on chip that can be located anywhere. It can give a portable solution and can give results in a matter of seconds. So we taken that and we put it and connected it to an AI engine and basically created the ability to build profiling of reaction for specific virus. So when we started, we did it for other different kind of pathogens, different kind of viruses. We tried chikungunya and dengue and many other viruses that were available in the lab, because when the COVID started, we didn't have immediately access to everything. So we started with this to validate the theory. And once we have done that and received a classification of almost 100%, it sounds crazy in the science world and medical world, but it was all validated by Sheba Medical Hospital in preclinical trials. We switched to COVID. And then we discovered we had a huge success in detecting reaction for COVID as well. So right now we have more than 30 pilots running in the world. Actually, we're going to release this week some more results of pilots in a few countries. We are submitted regulation approvals in countries and also in the US, the emergency FDA approval. We're going to hopefully have some press release about it in the next week. With a leading institution. I cannot name it at this point, but hopefully it will be published by next week. And we have obtained extremely high accuracy during our testing. And I'm going to show you a little bit how we exactly do that. So this is the device. It's of new site. You can see it. Imagine it's a small box. It's in the size of a computer mouse, maybe an ashtray. It's very small. It can be located everywhere, and it's based on our spectral chip, as I explained before. And basically, it's a spectrometer, like any spectrometer you might have heard, but it's very unique because it's very sensitive. It's very affordable, and we are able to put our technology in a way that it's perfect to an artificial intelligence agent that we have built to create a clear classification between healthy and sick. And basically, we have the main thing for other use cases in the medical world, which I'm not gonna tell you about it now, but if you're interested, you can contact me later and I can address that too. So this is just how the full solution works. So basically, we have the device of new site, we have the software and all the data generated by VirusSide app, and all the agent and all the clinical studies of the generating the profile and the data is getting there. And basically, the product works in a way that you use our device, you insert. We support both methodologies of mouthwash and swabs. I'm going to show you exactly how, and that's going to be my last slide because I know I don't have much time left. You use the software. It can be in the PC, it can be in a smartphone. We are going to release it soon. It's pay per check. You just press a button and then you get your result immediately. So it sounds science fiction, but it works and it's pretty exciting. Here you can see some results of the classification we did with swab test and mouthwash. You can see we had quite amazing classification between healthy and sick. I can elaborate more about that later. And this is the methodology, and that would be my last slide. You can see that you have both methods to do the test. One is actually taking the liquid after the swab. After you take a regular swab test, we can use the liquid with the UTM liquid left. We dilute it a little bit in the PBS. We insert it in the SpectraLite in our device. Use the software, and you get your result, positive or negative. And the other methodology we support is mouthwash. We were published by it around the world. You gargle a few seconds, regular saline water. You spit it inside a tube. You insert it into the SpectraLite the same way. You get your results. So that's basically what we have done. Unfortunately, I don't have time anymore, and I'll be happy to address more questions in depth later on.
Michal, thank you very much. That was really interesting and very much appreciated. Let's go to the next presentation. It's going to be a joint presentation, actually, of Matias Gutierrez and Sylvia Franco, Genosur, and Body K. Matias is a biochemist and PhD in biotechnology, and since 2005 he's been contributing to the development of science, education, and biotechnology. Over 2,000 public schools in Chile study science using the Experimenta hands-on curriculum developed by the team of his first company, Bioquímica, based in Santiago, Chile. Sylvia is a high-value executive in communications, marketing, and growth-focused campaigns for global brands. She brings almost 2 decades of experience in communications, strategic development, entrepreneurship, with vast experience with startups and the like. Her focus is to take Body K to the next level in the wellness industry and within product deployment. She's highly motivated to help people change their stories, becoming a better and healthier version of themselves. And she has a degree, an MBA from Northwestern's Kellogg School of Business Management. So let me now ask Matias and Sylvia to make their presentation.
All right. Good morning, everyone. Thank you so much, Josh and Dr. Bookman, for this space today. So we decided to make this short presentation to innovate a little bit and change the dynamic. Hopefully, you'll enjoy it. I'll start off by talking about Genocide and what we did before the pandemic. Basically, we are in the business of developing vehicles for biological samples so that they can be transported in the best condition possible at room temperature to the destination lab where they're going to be analyzed. So a year ago, when I started, I did a presentation actually for the Life Sciences and Healthcare Committee where I was showing them this product that I was showcasing in various business meetings and whatnot, trying to get clients that have were in the space of DNA analysis and genomics, you know, like the 23andMe, like or Ancestry.com, and we had this product. We also were developing different other sampling solutions to look at microbiomes and also composition of microbes that inhabit the nose, the gut, vagina, etc. And that's what we were doing back then. And as I said, the whole concept was to bring samples back from anywhere, basically, to our lab in Miami to be analyzed and be able to give a diagnostic or learn more about the kind of microflora that inhabited your body.
Hi, thank you so much. I wanted to also introduce Mari Martinez, who's our CEO and my business partner, and we're so absolutely extremely grateful to Josh and Dr. Bookman and Sam, and it's honestly just a privilege to be in this panel with all of you. So yes. Our perspective is going to be a little bit different. We are a COVID testing company in South Florida. So what we're going to discuss is really how our company started and how we pivoted into COVID testing, which really goes hand in hand with what we were able to see in the scale of COVID and in the pandemic within our community. So Body Case started in 2019. We launched as a preventative health company, and you know, as any startup, we're ready to launch in 2020 and are hit by the pandemic. Because we were already into the testing company and we really wanted to focus on getting people healthy, we discussed pivoting into COVID testing and how could we actually become involved. Do you want to present a little bit?
Yeah, it's okay.
Okay, so when we started, it was with the concept of we come to you. We wanted to present concierge, and we created our network of nurses, and we began with antibody testing.
Okay, so the pandemic hit, and what we found out is that people were waiting 7 to 10 days to get results, and we needed to find a solution for the community. Because what we saw was desperation, really, and lack of information, you know, around the community. So we partner with several labs, local and within the United States, that are private, that, you know, we could make the solution of giving results within 72 hours. However, by September of this year, we got to get even better for the community, and, you know, to offer tests that are same day and next day. And our main purpose is basically to find a global solution, which is more efficient in turnaround times, you know, very short, like same day or next day, but also to be able to offer a solution that is, how do you say, monetary feasible for the masses.
That is cost efficient. And those were two of the things that we saw in Miami-Dade County. So before there was ample testing within our city, and even when it started, people were in that, as Mari mentioned, in the state of desperation where they needed to know, because we, you know, when we were in July, we were looking at a lot of sick people. and they wanted to know whether they had COVID or not. And so we were able to present at that time very fast results, 72 hours, where today we're able to provide same day results. But our client has changed enormously. One has to do with something that Sara talked about and the phenomenal job that they have done. And it was just so impressive for presentation, which was how Miami-Dade has really come together to provide testing with fast results for our county. But we also see that there's an enormous need in other people, in corporations, in businesses. We work a lot with production companies. Once Miami began to open, we saw that businesses wanted to come back, but not everybody can go and do a line and have that type of access. So that's where our niche is really very strong. And what we found also was that we were able to provide very fast testing for people that wanted to travel to the US. So we have people that contact us from Latin America and from Europe because they already know about our company. Mm-hmm. They need to do business here. They want to make sure and confirm that they can have the result on the same day so that they can get on the flight. And so for us, it's been a privilege to really be a part of her working with the community, working with businesses, and now working to help open Miami up to commerce and tourism. So thanks to that, in October, a few weeks ago, we were recognized by the Beacon Council, by Miami-Dade County, with a key to the county, which has been an enormous privilege for us, and also for Matias. And so due to this, one of the things that we just found was a natural partnership. And so starting this week, both Genosor and BodyK are coming together to offer the most efficient, rapid, and low-cost testing for our county. Yeah.
Yeah, so the collaboration that has been set up between our companies has to do with the experience that BodyK has elaborated about identifying the diverse needs of those who live and visit this county during the pandemic, which has been a tremendous learning experience. And Sylvia and Mary can share with you the amount of crazy different needs that have been found. There's very humane stories and they require the need, but as Sylvia was mentioning, right, the main points that were identified is that one of the biggest pains right now is cost and time, and that's what we're solving together. So the idea is to have our technology be put forward so that we can get 4 hours turnaround for the immediate needs of several industries within the county. And well, through this pivot, and both of our companies were featured in various outlets because we've been innovating and pivoting onto understanding the needs. I don't know if you want to talk a little bit about the slide, Sylvia or Mari.
Sure. We've been featured on with Univision and Miami Herald and NBC and a few other media companies because and a lot of this was happening during the peak July and then August, where there was this need for testing, and we were able to come through. We were also testing many schools, helping them to create a strategy to open their doors. And so we were testing students and faculty weeks before it was even in the conversation. So for that reason, we did receive ample coverage.
Mm-hmm. And so it happens to us. So as I was telling you, we were manufacturing devices for other purposes. And when the pandemic hit, we pivoted very quickly into developing a device that could allow for safe sampling of patients of fear of being infected by COVID all around Chile in this case. And out of those 4 million tests that Anil mentioned earlier in his presentation, at least 1.5 of those were made using Genosor's technology. And right now, this technology is being put into use to help the county solve these needs that we've been talking to you about. And more importantly, we've iterated on the innovation, and we've been able to develop a new method that allows for this incredibly fast turnaround, high throughput, low cost PCR results that we want to, within this collaboration, put in the hands of all of the needs of the county. So here's where we're at right now. We want to give the county affordable PCR results in less than 4 hours. And Sylvia, Mary, and I, after the Beacon Council meeting last Thursday, we were talking about like how it felt to be mentioned between the companies that were featured, like the honor of being awarded the key to the county. And basically we feel a responsibility within this circular economy that was mentioned many times within the meeting to provide solutions for the needs of the county by Miami locals. And I've been here for a little less than Sylvia and Mary, but that's how I feel. So yeah, that's what we wanted to share with you, and we're open for questions.
Thank you.
Well,
Thank you.
thank you very much. Thanks. Really appreciate you sharing this with us. I mean, one thing that I think stands out from all the presentations is how far we've come from where we started with COVID-19 coronavirus, not having any or very little information and methodologies and the like. And now people are in, testing. You got tested, and 7 days later you got a result, and now you can get a result within 15 minutes or 4 hours or however it happens. So I mean, it's just truly amazing to me how far we've come. Let's go to questions and answers, and we have a few on the board. I know that Richard Bookman wanted to ask a question about to Neil, and let's just go from there. If you have questions, please put it in the chat.
Sure. So I'm actually, thanks, Josh. So in light of what we've just heard, I want to see if we could bring a few things together, and you'll see where I'm going in a minute. Consul General Siegel, you mentioned airport testing, and I'm curious about that, because arguably if we could set up the right scale of testing at Miami International, that would be good for both outgoing and incoming folks as well. You suggested that there were some green lanes. I'm just wondering if, in light of what Matthias and Sylvia have been talking about doing here in Miami-Dade County, can you tell us a little bit more about airport testing in the EU?
Yeah, thank you. Actually, the situation in Europe is still under discussion and evolving. Now, I think it was a few days ago, on the 8th of November, that in Germany, at least, a new regulation entered into force, which sort of ignores and puts aside airport testing. But if you're coming from, if you're traveling, let's say, even as a diplomat, if I travel from here to Europe, I am able to do that, even though I'm supposed to come from a high-risk country, which is the United States. I can travel to Germany, but I have to quarantine, whatever the circumstances, for 5 days at least. Then I can request with the local health authorities. I can request to take a test, and if that test is negative, I can sort of cut off the quarantine, which normally would have to last for 14 days. Now that is a new regulation in Germany, and the situation in other countries is evolving also. Actually, I think there was not a sort of a whole coverage of all the airports before. The opportunity to get tested at the airport, I think, is still there, but as it is no more obligatory, or it does not actually facilitate your transition when you're coming from someplace, because you have to go into quarantine for 5 days anyway. I think that that will also disappear eventually if that regulation is upheld. So actually, we're still evaluating how this, how the impact of all this is. And I think in a month or two, there will be new regulations in place.
Yeah. Matthias and Sylvia, any thoughts or discussion about trying to set up testing at MIA? You're muted, Sylvia.
Sorry about that.
That's okay.
So absolutely, we've been in discussion with Miami-Dade, Miami International Airport, actually for a couple of months. And one of the reasons that we decided to come together was because we felt so strongly that we could actually bring a very different solution. And that solution is with Genosor. They have a mobile lab. They have a capacity for a mobile lab that provides 4-hour testing. And so having that capacity of having the mobile lab at MIA Park and us being able to test and being able to provide such a quick turnaround would allow at an incredible rate the ability to test people that are coming in and actually not people that are coming in, people that are going out, which is where, especially in Latin America, they require the PCR test.
Yeah, so on the other hand, it would seem like the technology that Mikhail was describing from VirusSite would be exactly the kind of thing, you know, arguably you do before you let any passenger on an airplane or you know, something like that. So 4 hours is a long time to sit in an airport waiting for a result.
It's very similar also to the, I mean, not that I'm saying that technology is mind blowing, but what's happening right now is that if they do not see PCR and a PCR in a report, people are being turned around. So for example, you can't get an antigen test and go to the airport. You can't get a rapid test and go. And again, I don't know the technology, but that's what's happening right now. When we see that all the time, people go to the airport and they just will not let them board. They need to turn around, they need to go, and they need to they've been tested here in Miami. It wasn't the right test and they missed their flights. We have people calling us that are missing their flights all the time. And it's because the word PCR needs to be on there. That's the gold standard, and that's what they're asking.
And to that point, Dr. Bookman, also, we have various ways of obtaining the sample so that the person doesn't have to be actually sitting there waiting for 4 hours. Our 4 hours turnaround time, it's basically what we're committing. Actually, our technology allows us to get results in less than 2 hours. So there's a combination of factors, and of course, it's going to be approached in a way that makes sense for everybody involved.
Right. Thanks. So Anil,
I just wanted to comment, if I may.
Please.
That actually we have signed with the company who is doing the operation in 120 airports around the world, and we are going to start just in matter of, I think, a few weeks, pilots in a few airports as well. And the idea is at the first stage, I don't want to enter to, I think there are many great technologies and many great ways to counter this problem. There is not only one approach. And I think all the approaches are necessary because it's a real problem for everyone. But what we are trying to do, our approach to that problem is at first stage, we're going to be as a screening test. And of course, until we get the validation to replace PCR one day, which is our goal, it will be still needed to be alongside PCR, as Sylvia and I apologize, other guys from your team mentioned. It is the golden standard, and right now we are doing our tests also to match and show a validation next to PCR. And that's actually the first stage, right? So we do the screening test, and if there is uncertainty of anything, someone can get tested again. But we try to avoid any false negatives. Because if it's false positive, you can tolerated, right? Because the worst case scenario, the person will go and do a PCR test. But the worst case scenario, what the aircraft industry cannot tolerate is someone who is false negative, and then he will come and infect everyone in the aircraft. So that's something we are emphasizing in. And the next step will be for us to also one day replace the PCR once our technology will be in the deep learning mode of the AI, artificial intelligence. So we'll get enough data to provide also accurate numbers of viral load, similar to PCR, city levels. We were able, I couldn't show it here because it's not much time for it. And I had to like throw a lot of information all the way around. And I hope some of it understood it because there's a lot of it. But we are capable of giving indication of viral load as well in city levels, like PCR. For now, since the data is still small, as artificial intelligence works, once you get more data, you improve the accuracy. So for now, we commit to low, medium, and high, and eventually we're going to also commit to specific numbers. So in the future, we do intend to also be able to replace in some sort PCR, but not in the first stage. So I believe that in the first stage, to release the economy of the world, PCR tests will be needed as well. So I understand Sylvia's point, but that's our approach. And we are definitely going to tackle the next step very soon and also be able to replace PCR tests in the future.
That's neat.
Thank
Thanks,
you.
Michael. Matthias, you had to say something? You had a comment,
I have a
Matthias?
question. So, Michael, the technology that you've presented, does it require any kind of a COVID-specific marker, or is it just a spectrum that you're getting from the sample?
Basically, what we do is we don't diagnose the virus spectrally. That's not, if you read a little bit of their slides, that's not possible in those wavelength and not specifically for viruses. What we are doing is actually we're tracking the reaction of the person to the virus, and we can identify different reactions. For example, if we're talking about airports, imagine we have a device that can support not only COVID, for example, but if we're talking about other places in the world who are closed sometimes because of dengue fever or many other things. So we already tested all of this also for other kind of viruses, and we show clear classification, not only from infected and non-infected in that specific virus, but also between different viruses. And now, since the flu season will happen, what we're focused in our research, that's why we have Sheba behind us, which is a huge medical center, very innovative, has a lot of traction and a lot of hospitals in the world. And what we're trying to do now, when the flu season will start in Israel, is also show classification between people having flu, because in terms of symptoms, it's very similar, and it can be very confusing. It can cause a lot of chaos. So that will be our next step as well.
And it works with non-symptomatic individuals as well, or is it symptomatics is necessary in order to capture the response?
So from what we have tested so far, so from the tests we have done so far, of course, we haven't touched and specifically that topic, but I can tell you that we are certain of our ability to do that, because when we did the clinical trials in the first clinical trials we did in Sheba, we used people from special healthcare houses Israel has made for COVID patients or COVID sick people, hostels. I'm not sure the terminology in English. So there we collected samples of many patients that were asymptomatic as well. And we were able to still create this classification. So for us, it wasn't an issue in our collecting sample, but in the future, of course, we will want, when we enrich the data, we would want also to get more clean information about that and tackle that. And this is something we're definitely doing. But for now, we were confident that even without doing so, we were able to achieve, and mixing those target audiences that we tested, symptomatics and asymptomatics, we still achieved amazing results. So we're quite confident that wouldn't be a problem for us.
Super. Thanks, Mika. So,
Thank you.
so Anil, a couple of things struck me. I wonder if you might talk a little bit more about what these dynamic lockdowns are. How local have you been able to make them? I mean, is it locking down whole cities or neighborhoods within cities? But before you get to that, I'm really struck by Chile's extraordinary geography. It's just this damn long, skinny thing with climate that is so different, you know, in the north from the south. And I'm wondering if you've seen, you know, COVID incidence differences according to the geography and topography of Chile as the pandemic has rolled out in your country. So 2 questions for you.
Sure, thank you, Richard. We haven't seen, I don't know that there's scientific data or studies that have really made some correlations between the different latitudes and the incidence of COVID. So, but that's a good question. I'll ask around my epidemiology team, but I haven't seen anything out there that really relates that. What we've seen, of course, is that there's more COVID incidents in those regions that had at the beginning maybe more access to travel abroad, and that's where our first focuses reached. And of course, they were controlled, but because of our social mobility in Chile, the people that work for these wealthy places were moving back and forth between the big capital, right? So then the whole capital got basically the virus. So what we did in these dynamic lockdowns was that we closed specific neighborhoods, which are called comunas here in Santiago, inside Santiago. And those comunas, based on their incidents, they were closed and nobody could leave. And basically we had like police really on the borders of each. And if you were caught going from one neighborhood to another one, you had to have your basically something that determined why you were traveling. And of course, a PCR test showing that you were negative, right? So that was the way that we're trying to do it, basically educating a kind of population. I want to say that the Chilean population was very responsible. We stayed in our houses, and that was the main purpose of doing this. And I think people complied, specifically in April, May, and June, where we had our crisis here in Chile, and where all the health system was saturated. And then after that, it declined. I think we're now in a better situation so far. We can never say what's going to happen in the future, but if we have to go back to that, I think we will. And like I said, the people and the Chilean population acted very responsibly. So that was very good for us.
Yeah, thanks. I wonder, Consul Siegel, if you might comment about within the EU or perhaps just Germany, you know, have you been able to do sort of very focused lockdowns so as to sort of minimize and really focus that mitigation strategy? Or do you tend to just take out, you know, Berlin or Bonn or, you know, larger metro areas?
Okay, can you hear me? Yes.
Yes. Yep.
Actually, as I indicated during my talk, there is a limit to tracing and limiting these kind of lockdowns when you reach a certain level of infection. So what was possible in Germany, there were 2 factors which facilitated a good sort of identification of clusters and tracing in the beginning. The first one was that we had a test available right away in February, March, which was available in different areas. And we had 2 outbreaks which were regionally quite identifiable. And so the first sort of restrictions of movement applied to these 2 clusters, which were quite closely verified, and that helped actually to curb the spread in a very significant way. And also, well, the fact that our hospital system and health system has sort of a long-standing quality tradition helped us that Germany was able also to accept patients from other countries in Europe. where the hospitals were oversaturated already. So our casualty rate in the end also is significantly lower than the average in Europe for these reasons that I think in the beginning, very targeted efforts were made to mitigate and to limit the spread.
Thank you. Thank you. Also, while we focus a little bit on Germany, I'm so happy that you mentioned the important role of BioNTech in the vaccine, which is now all too easily referred to as the Pfizer vaccine, when in fact the science started at BioNTech. And I particularly want to call that out here in the context of Miami-Dade County, because the founders of BioNTech were not native-born Germans, rather they're immigrants who moved to Germany and started a business, which is now may help to save the world. So, if for those who are fans of global mobility and nurturing talent wherever it comes from, I think the BioNTech story is a great story, and hats off to Germany.
Let me ask Consul General something also. You had testing, you rolled out testing in March and April. Was there any coordination between you and the US or between the European Union and the US on testing, methodologies and technology and the like, so that testing could be uniformly done?
Well, as a matter of fact, the communication and the knowledge about testing only evolved over time, I think it took quite a while before Germany itself got the act together, because we are a federal state as well, composed of 16 different state governments, and the prevalence of the virus was quite different, and was in the first place limited to North Rhine-Westphalia, the Rhine Valley, and Bavaria. But then it spread obviously across, and also across the borders. And so it took a while before the Länder, the state governments got together also with the federal government to approach a common strategy. And then the lesson also had to be learned that that is not sufficient. You needed to go further. You needed to have a coordination on the EU level. And of course, today the lesson is it's even not sufficient. We need to go beyond, and we know we have to coordinate and to cooperate on a worldwide scale, which of course brings into play also the World Health Organization, where Germany and Europe has pleaded to use also the tools that they have to do comparative studies, to follow recommendations, and also to have a communication effort there. Unfortunately, also the initiatives that were taken by the European Union for finding a vaccine, for finding a common testing technology. There was a big fundraising event I think it was in June, where unfortunately the US abstained and did not wish to participate. But the prevailing view in the EU is that we have a responsibility not only to care for ourselves, but also to look into what's happening in other continents, in particular Africa and Asia, for example.
Very nice. I don't know if there are any other questions. I don't see really any on the chat. And if there are not, let's wrap up. I want to thank Richard and the Health, Life Science and Healthcare Committee, who've done just a fantastic job of organizing this. We've just kind of tagged along and marveled at the technological depth of the committee, the Life Science and Healthcare Committee. And so I want to thank them very much. And I want to thank all the speakers very much for having been a part of today's presentation. Richard, you want to add any final words?
Thanks, Josh. Just really thanks to not only the speakers, but also those sitting in. It was certainly our committee's hope in working with Josh's international committee that we bring together the right balance of science and business and health, and sort of realize that, while we are far from over this thing, that we've got lots of wonderful people thinking very carefully about how to mitigate now, how to vaccinate later, and how to get over this. So hats off to all the entrepreneurs, hats off to the public service folks, and look forward to continuing the conversation with the international community. So with that, back to you, Josh.
Well, thank you. I mean, once more, thank you. And I want to thank all the staff of the Beacon Council who've been so helpful in organizing this too. Mario Sarcasa and Sam Blad and Christina Ojeda. You guys are just fantastic, and this would not have happened without you. So very much appreciated. And with that, I believe we are concluded. Thanks, everyone.
Thank you. Thank you all. Thank you all.
Thank you.
Very much.